What I have noticed is there seems to be a vicious cycle in which stress is the essential element that affects people living with MS. The cycle is as follows. First starts physical and cognitive changes, then comes a stress reaction, and then after that a pseudo-exacerbation of a person's symptoms. So a person experiences more symptomatology that may be potentially debilitating. One of the benefits of mindfulness-based stress reduction is it helps people break that cycle in order that they might be able to live a better quality of life, which is my goal working on a comprehensive treatment team for sure. Most mindfulness techniques allow people, instead of worrying about what has happened on the past or anxiously anticipating what might happen in the future, to focus on the present moment. And in doing so, they're able to alleviate themselves from that stress. It is something that comes along with diagnosis of a chronic, progressive, and curable illness characterized by unpredictable flare-ups of symptoms. However, simply by virtue of someone being diagnosed with a chronic illness does not mean that she is ineligible to enjoy a good quality of life. And I hope that by using mindfulness-based interventions with the people I serve, that I might be able to help them achieve that good quality of life. It works across a wide variety of patients and constellations of symptoms. I will say that for a person who is significantly cognitively impaired due to progression of her illness, that it may be much more difficult for her to begin to practice mindfulness. However, I don't really see any restriction as far as the demographic is concerned. The beauty of mindfulness-based stress reduction as it was popularized in the US is that it is the meditation practice in Buddhism minus the religious dogma. So for a person who is averse to different spiritual practices or spirituality in general, removing dogma removes some of that bias that a person may potentially have, therefore opening up more people to the mindfulness practice as appropriate. As far as literature is concerned, the literature that I've reviewed, quite honestly, is very inconclusive regarding MS specifically. For treating stress in general, or for treating people who have serious mental illness, especially serious mental illness regarding modulation of anxiety, mindfulness-based stress reduction has been very successful. In a review of I think 4 different studies in an article published by Simpson and colleagues last year, one of the difficulties that he experienced in reviewing these articles in a meta-analysis was that the means of measuring participants' subjective experiences of anxiety were not standardized. So instead of using say, a standardized anxiety inventory. Instead, some people looked at quality of life. Other people looked at anxiety as manifested by diagnosis with a serious mental illness. So there was no standardization, therefore it's difficult to generalize. In my experience, in my practice, working with folks, the way I present things is very simple. And what I try to do is give people something that they may carry with them. A skill that they may use, a tool, so to speak. I think because there has not been a wide interest in studying the effects of mindfulness working with people with multiple sclerosis. One of the things that I think might be biasing some researchers is that, traditional medicine, mainly treatment with disease-modifying therapy medicines and other physiological agents to control some of the symptoms that are secondary to MS, Using something for which there is no tangible benefit and no standardized measure may discourage many from even attempting it, simply because it is so challenging to see the effects. I use my own judgment in working with the people that I serve, and if this is an intervention that I think will be of a benefit to them, I try it. And if it works, hallelujah, they have a tool. And if it doesn't, well, I've tried, and we'll try something else in order to ensure that they can have a good quality of life. I think that many people around the country have begun to see the benefits of mindfulness. Mindfulness-based stress reduction programs were started at academic medical centers as a means of treating medical providers. This was back in the 80s, up in the Boston area specifically. Once it was shown to help people who help others reduce their subjective reports of anxiety, the authors of this technique moved on to treat people who had medical ailments. I think that with the popularity in academic medical centers on the East Coast and also throughout the US, that this may become more popular. In the MS population specifically, I think there needs to be significantly more strong research in favor of the benefits of using mindfulness.